Loved pet health coach. I hope that everyone is doing well and that life is good and easy. So we've got a couple of questions over in the group. So let me pop over there and go. There we go. Get the infinity screen going. Okay. Um, let's see, all the way down here. All right, Kay. If there's something going on in the rear leg and you have a 16-month-old Westie, this is definitely X-ray time. Unfortunately, Westies can get something called Legg-Perthes disease or avascular necrosis of the femoral head. And those are all big fat doctor words, but essentially what that means is this. So if the femoral head is sort of the ball part of the ball and socket joint, this gets a lack of blood supply and literally just crumbles. And so that can be exquisitely painful. Now, the other thing that could be going on would be something like a knee injury or some other joint issue as far as in the hock they can have some abnormal growth of the bones, but that's more common in Labradors. So definitely time to go to the doc and get some x-rays of the hips and get a good exam to see if there's something going on with the knee. So let's see here. So let us know how that progresses, but I think with that many episodes, it's time to go get it checked out. And May, I don't know why people are saying not to give kittens fish. So there's this whole thing about uh, if you feed only fish, then they can become B1 deficient. So I think we can, yeah, this is switching tabs with this. So, uh, whole fish is dangerous because of the bones and they don't get enough to support vitamin K synthesis and yada yada yada. So I don't know what this is all about. Um, and yeah, we think of fish being what cats eat, as far as if they live at the shore, and indeed they would, but really it is more birds. So I think having some sardines or mackerel is perfectly fine, but maybe it's not the main protein in the diet. So I don't know what the deal is. And then with the kittens, here's the dirty truth about the rabies vaccines. The 1 year and the 3 year are almost always the exact same. Um, the reason it gets licensed for 3 year vaccine is that it presumes that the pet, the dog or the cat, has had a rabies vaccine at roughly 14, 16 weeks of age. And then when you give the booster vaccine, then the immune system can respond for 3 years. And then the other two, the upper respiratory vaccines, yes, do those at 12 or 14 weeks. And then if the vaccine is at 14 weeks, that's actually all they would need. If you do it at 12 weeks, you would need to booster at about 15, 16 weeks. Use Thuja after each of these vaccines. Part of what the theory about the crazy amount of kidney disease in cats is that many of the cat vaccines are grown on cat kidney cells. So while they develop antibodies to the vaccinations, they also sadly end up developing antibodies to their kidneys potentially. So that's why we want to really focus on limiting vaccines. But the FBRCP vaccine is feline viral, rhinotracheitis, calicivirus, and panleukopenia. So those two upper respiratory viruses Feline leukemia FIV test, I think, is a good idea, just so you know. And I think I saw something about the kittens sneezing. Um, and likely this is an upper respiratory infection. So you might consider giving, you can do, try some CBD, see if that helps. You could try using lysine at, I think it's 50 milligrams. There is a lysine paste for cats, Inosome. There you go. Okay. And this, sorry, this is in Slovakian. I can't really read it either, but this contains lysine. I think this is the right one. Yeah. Uh, and so it's 250 milligrams per dose. That will help protect the other kitten. It may or may not reduce the severity for the other ones. And then you've got, and I forget the name of the respiratory formula that Young Living makes, but I'm sure you've got that. So a drop of that in your palms. So, and then just sort of around the head. If she's sniffing, then, oh, good. Uh, good. Then you're good to go. And good. The sneezing went away, which is awesome. Um, Almond milk, I would not really use because there's not, yeah, I would skip that. Use a small amount of real milk if needed for a treat. And I think I saw that you got them on the diet, which is fantastic. So give yourself a big pat on the back for getting them converted. I don't think you need to leave food down all the time. We feed Pepe um, twice a day, although he thinks that's horrible sometimes. The idea behind leaving food down all the time especially applies if you are feeding dry food. And the idea is that they have less variation in their urine pH, and so would be less likely to develop urinary tract infection. So, if you think about cats, if they were out in the wild, they would be, um, they need to catch something like 15. Uh, not converted at all. They would need to eat something like 10 or 15 mice a day, I think. And so they're going to eat frequently through the day, but only because it takes that long to catch all the mice. So Faith won't touch the wet food. So just keep plugging with it and keep a little bit to the side. That's interesting. And she's the one that's sneezing. Oh, okay. So no, it had said in this message that they were eating the chicken meal and still mixing with the canned food that they're used to. So if that is the case, if they're eating the chicken stuff, then just keep going with that and start just taking the dry food away if you can. And then Feliway, yeah, you could use it if they're anxious. If they're pretty chill, I think you're good to go. Feliway is a pheromone, and so it does help to reduce anxiety. The one for dogs is called Adaptil, but yeah, Feliway is a great product for anxious cats. So I think that's all good stuff. Um, yeah, I still don't understand this whole thing about not giving fish at all. So I don't know. I think it's like everything in life. You have to um, moderate things. And there are cats that do well on fish-based diet. All right, I think you're it, May, on for today. So, any other questions I haven't answered for you? I'll give you a minute there. Um, yeah, I wish I had something exciting to say, but I don't. But yeah, if she's sneezing, definitely go with the if that comes back, definitely go with the Anisil because that will help. Unfortunately, these upper respiratory viruses are like herpes virus where they can recrudesce, so you definitely want to stop that in a hurry. But yeah, everything else your vet's saying, I think, is reasonable. Okay. All right. That's what I got for you today. Until next time, give everybody a big hug. And I'm glad Spirit and the kitties are starting to get along well. At least they're united in their desire to have sardines.